Hi, I'm Carrie Elizabeth Lynn. I'm a licensed professional counselor and I also have bipolar disorder myself. Today I'll be talking about the difference between bipolar disorder and schizoaffective disorder, which I'll refer to as SD. I'm not going to go over full criteria for SD. I'll just talk about the main differences between it and bipolar disorder. I want to help explain the differences between bipolar disorder and illnesses that are very close. So in my last video, I talked about major depressive disorder, and in this one, I'll talk about SD. There are two types of SD, depressive type, where people experience only depression, and bipolar type, where people experience mania and may also experience depression. In this video, I'll be focusing on the bipolar type. I often hear people say they have both SD and bipolar disorder, but by definition, you cannot have both diagnoses at the same time. However, it is possible for a diagnosis of bipolar disorder to be changed to SD and vice versa. So what is SD bipolar type? Well, simply put, it's a combination of the psychotic symptoms of schizophrenia and the affective symptoms of bipolar disorder, hence the name schizoaffective disorder. In 3 previous videos in this series, I described manic episodes, hypomanic episodes, and depressive episodes. And in another video, the one on bipolar 1 disorder, I talked about how people with bipolar disorder can experience episodes of mania or depression with psychotic features. Now, some people with bipolar disorder experience psychosis and some do not. But if they do, they experience it as part of a mood episode, specifically a manic or depressive episode. In other words, people with bipolar disorder don't have psychosis when they're between episodes, at least not full-blown psychosis. People with SD bipolar type also experience mood episodes. They have to have experienced a manic episode along with psychotic symptoms of schizophrenia. And like I said, they might also experience depression. Unlike people with bipolar disorder, they've also experienced psychosis when they're not having a mood episode. Specifically, they have to have had delusions or hallucinations for at least 2 weeks in the absence of a mood episode. In other words, between episodes of mania or depression. People with bipolar disorder may also experience some psychotic symptoms between mood episodes, but they're likely to be mild and fleeting. It can be hard to distinguish between bipolar disorder and SD. A mental health provider has to take a thorough history in order to make an accurate diagnosis. Also, as I mentioned, the diagnosis can switch from one to the other. I want to point out that SD is a controversial diagnosis. It doesn't have great reliability or validity as a disorder. In fact, it's not even clear exactly what it is: a distinct disorder, a subtype of a disorder, or a combination of disorders. In this video, I've just given you the basics of how it's currently understood. So those are the major differences between bipolar disorder and schizoaffective disorder. Thanks for watching, and here's to good mental health.